Okay, well, there's been some big changes with Google, and you got to know what they are. Hey, it's Dan Brown. I'm the Senior Service Consultant here at MGE Management Experts. And I'm just going to tell you there's been some massive changes with Google that I think you're going to need to know about if you haven't heard already. These are things to just now understand, what do I do? So let's talk about what the changes are. First of all, one of the most major changes is that Google has changed how your paid ads are actually attracting interest. What they have done is they have taken very specific search terms and keywords and keyword phrases, such as dental implant, if you're advertising for that. What they've done is they've generalized that, and now they're allowing other associative terms to count on your Google paid ads. What does all that mean? Well, somebody could be looking for dental implant supplies. Well, you don't want that. But now it's going to be kind of grouped into what you've been doing, unless you have a skilled manager handling your Google ads. You're going to want to ask them, hey, have you heard about the new changes with Google? Good. What are you doing to change or maximize my account? So you may not be doing Google paid ads. I'm going to tell you about something else you need to know about. But if you are doing Google paid ads, you got to jump on this one. What will happen if you don't? Well, you're going to see your budget disappear real quick, and you're going to see less phone calls coming into the practice. That is, again, because Google has done what they've done, and I can't tell you why. I can kind of guess why, but they've opened up what that search term is and how it could apply broadly, and they're going to burn through your budget if you don't make exact specific changes. So that's the first thing to know. Okay, the second thing to know is that they have also changed some of the search criteria for what we call organic searches. Now, what's an organic search? Organic means not paid. So you could be doing Google paid ads, which I highly suggest you do. And you could also be ranking organically. And that means when somebody searches, they find you at the top or near the top of a dental-related search. Organic will probably see 10 people, where a paid ad search will get one person. So out of 11 people, 10 people will go for an organic search result. One person will click an ad. And you think, well, gosh, that seems amazing. Why should I even bother with paid ads? Well, 1 out of 11 people generally in your area is a lot of people. So paid ads work. And if you're having a hard time getting yourself to rank towards the top, yeah, you do paid ads while you're working to get your organic rankings up with what's called search engine optimization. Good, so let's talk about organic. Organic has over 200 factors to get you ranking towards the top of an organic search. You, dentist near me, you want to come up towards the top, you got to know those things. And it's not just necessarily you searching your own computer or your own device, because Google knows that you go there pretty routinely, and they're probably going to show you a little bit higher than what you would actually show up to somebody who doesn't know you, has never been to the practice. That's just kind of the way it is. So are you going to know those 200 factors? Probably not. You're probably going to hire somebody to do your search engine optimization. But who's the right person, and how do you do that? Well, we talk about that extensively, this and many other things, at the New Patient Workshop, which is a 2-day online live Zoom-based seminar that we do every 2 weeks at MGE. I would suggest going there because we cover so much of this and more, and in detail. But I'm going to give you some tips right now, some things you should think with. First and most important, you are not going to appear like you should if you just search from your own device. So what I would suggest is get somebody to do a search who isn't your friend. Maybe it's from a library. You go to a computer and do some key searches, such as dentist near me, best dentist near me. If you want more implants or cosmetic dentist near me. Do some of these searches from a computer that's never been to your office, a phone that's never been to your office, but is in the geographical territory. Look at where you come up on those search results. Next, you want to ensure that you are getting a ton of reviews. How do you get a bunch of reviews? Well, we cover that in the New Patient Workshop. But Google has 3 of those 200 factors with and around the subject of reviews. So how many reviews do you have? What's your review rating? And how often are you getting reviews? And believe it or not, this last one right here, this third one, how often are you getting reviews, is the most highly weighted of these 3. So are you getting these reviews? Do you have a lot of them? And what's your star rating? How often are you adding them? This is the most important one. When you get these reviews, are you answering them? Now, it's a big ask. I know if you're getting a bunch of reviews, we show you how to do it in the New Patient Workshop, how to get about 10 to 15 a week. Well, answering 10 to 15 reviews, well, that might be a bit of time. But what is it telling Google? Google is seeing that you are not only getting good quality reviews, but you are engaging, you are alive, you are answering these reviews. And it shows Google that you're providing good customer service. And Google says, well, you know what? These guys seem to be doing a good job and they're in good communication with their patients. We're gonna go ahead and lift them a bit in their search results. And the third thing I'm gonna suggest is video. Now, you've probably heard people say blogs, do blogs, or you have a SEO provider that's doing blog items, right? Could be. Blog items could be, provided it's 100% organic from you on a very specific subject that's tied in with, a search or key phrase that is very popular. Now, you might not know what key searches are being done in your area that are popular, so you got to know what that is, and then you got to sit down and write something like 2,000 to 2,500 words. When's the next time you're going to get a chance to sit down and do that? But what can you do instead? Well, you can go on video. Look at what I'm doing right here. Now, I talk a little bit faster than most people, but the average person talks at about 400 words a minute. If I do a 4 to 5 minute video, I will pump out 2,500 words easy. Take that video, and believe it or not, Google's gonna take that and automatically transcribe that. If you've got that video and it's being hosted on YouTube and embedded in your website, I can help you with all these phrases. I know there's a lot of, we're in the weeds here, aren't we? I get it. But listen, if you just get video and it's on your website, your videos can rank much easier and much better than most of your content. So I'm going to encourage you to get some video content. Now, what do I say? I don't do video. I don't like looking at a camera. I'm overweight. I sound stupid. Well, everybody thinks that of themselves. You're your worst critic. So what we're gonna do is we're gonna have your assistant pick up the phone, yes, the phone. We're gonna turn it into airplane mode. We're gonna turn it sideways and hit record, and she's gonna say, "Doctor, tell me about what tooth sensitivity is and what causes it." And you're gonna talk to her with that phone for a few minutes about that subject. She's gonna capture that. You're gonna take that video, get some minor editing done, and put it on your website. That right there could be done in a few minutes. I would say 5 minutes on the outside, maybe even 7 minutes, and you're gonna have all the words you need. You do that once a week, once every 2 weeks, and you're gonna see that you're gonna be ranking higher and higher and higher because those items are straight from your heart and are very, very original, which is one of the key things Google needs from you, is original content. Not the content that your website company used for your site and thousands of others, but actual original content from you. So I hope that helps. And if you're confused, reach out to me. My email address is danb@mgeonline.com. I'll help you. We want to see you do well. We know that you're skilled clinicians, but this whole subject of marketing is kind of new. We'll walk you through that, and I hope to see you at the New Patient Workshop, where we do a bunch of this and a whole bunch more. Thanks for listening, and we'll see you at the next tip.